On today's show, we'll be busting a strange myth about HIV, discuss rheumatic heart disease, and meet a precious little girl with a congenital hand deformity. This show is brought to you by Vodafone. Further together.
So that mom can be able to open the door. This is it.
Please open the door.
Here's my little brother doing something special. He's setting the camera up with another bright idea.
Let's just open the door.
Yay!
Mom, I got it.
Now you can be part of the extraordinary world of endless possibilities on Vodafone. With the best value and amazing data offers and services available in Ghana, your dreams are achievable. Get more for less with Vodafone data. Vodafone, further together.
Dr. KK is poised to excite men with some new interesting surgery, but that leaves women with raised eyebrows, like mine. Up next, Mythbusters. Monkey ni fine.
Oh, how?
Monkey.
Monkey no fine, but mama like him.
Oh, what I could say.
Me, I say no fine.
Make your mama alone like him.
Thank you very much.
Somebody else they like him, trouble come.
Big trouble come. But seriously, is there any truth to that? Because I'd heard this before.
That's
Not someone had sex with a monkey,
okay.
but it was an experiment on monkeys. And because
Okay.
monkeys are closely related to humans,
Okay.
so they are primates and whatever, no, and that is how come HIV, no, so they are mutate.
So
That's what I heard.
So yes, I think there are a few truths here. One, HIV, while linking to chimpanzees and monkeys, it's been linked. There's been a link that's been documented.
Okay.
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 As to whether it was a sexually transmitted issue, I cannot speak for.
Okay.
What I can say is that the virus now know what monkeys will offend simian immunodeficiency virus.
Simian.
Simian. It wasn't HIV, simian immunodeficiency.
Simian
virus.
sounds like a name.
Yes. So that was it. Then it was they used to be human beings were killing them to eat
Okay.
them.
Okay.
I think somewhere in Congo. Somewhere in Congo. It was part of their foods, like how we kill goats. And
Okay.
eat. They also used to kill the monkeys to
Okay.
eat.
Okay.
So that is where the causal link, and somewhere in the 90s, 1970s, the causal link has been drawn. That it was probably from there that it came. Now, with everything happening with COVID and everything, you remember
Ebola?
No, COVID. They said that when someone dies, they don't give it to the family.
Yes.
Yes. We keep them.
Yes.
It's all with that theoretical risk of spreading the virus.
Okay.
So if you killed a monkey that had a simian immunodeficiency virus, and you came into contact with the body fluids of that monkey,
Which you would, because you have to clean it. The
exactly,
corpse, yes, and
then you are putting yourself at risk of introducing that into you. The sex part I can't speak for. But
Okay.
yes, it was for monkeys. Yes, it's a mutated form of the simian immunodeficiency virus. And I'm not sure what I'm about to say.
Well, yes, I mean, for me, it's a myth. Okay, we're thinking about it, but moving on, now the HIV is with us. It has caused, and until COVID came, it was causing huge problems the world over.
True.
And I think that we all are very aware of what the most likely mode of transmission now is. It doesn't matter whether it came from monkeys or it came from birds. Now we know that it is human to human transmission, sexually, mainly, plus all the other ones, blood transfusions, mother to child, all of those. So the advice and the emphasis should be on how we live our lives and the lifestyle that we participate in. I'm not trying to ruffle any feathers, but we also know that these days, the new, I want to call it newer variants of sexual intercourse.
Political.
I mean,
Newer variants. They've been there since. They've been there since. Are you older than Sodom and Gomorrah? They've been there since. Politics.
We know that those are also very high risk modes of transmission. So these are all risky practices.
I can hear someone asking, how is my way of life a risky mode of transmitting HIV? I can hear the person asking, as the person is watching. So just tell them.
I think
because you see now it becomes there's a lot of arguments about it, you know, because I've heard the argument about it, and then like straight people have one partner transmit HIV, they have say one wife, and so now the question is, how does my sexual orientation predispose me more than you that is having sex with
multiple partners?
One of the main issues would be the abrasion and friction that occurs through this mode of sexual intercourse. You know, there's a whole lot more friction, a whole lot more risk of exposure, you know, to the infected person. And that in itself is one way by which MSM is one important way by which HIV can be transmitted. And it is considered to be riskier than the orthodox mode of transmission.
I can still hear the person asking.
What's that thing called? Thought insertion.
See, I can hear that because you see, the arguments now are very strong and some sound very sound. You see, when you have man to woman intercourse, you realize that the woman gets wet. Yeah.
She gets lubricated.
Now, when that happens, it reduces the friction that Abba is talking about. You see, someone is asking, but afraid there's friction too on this side. But there's no way that the anal glands, or if at that arousal moment, would lubricate or secrete to respond.
Does it even have glands to secrete?
Oh, it has glands. There are glands there.
To lubricate it?
They have glands.
I thought it's for just when you are, when you're pooping.
No, yes. It has glands that have its own way of working. But they have their impulse, you know. They have their impulse that make them come.
Exactly.
You know, the way the
default
sexual settings. To the best of my knowledge.
All right.
Like I said, the arguments are strong these days. So I like to. So it's not a sexual stimulation to lubricate. But the vaginal mucosa has a sexual stimulation to lubricate. And that in itself has a way of reducing the risk of transmission. So if you are going through the other means, then you are increasing your risk of STIs.
That's true.
And HIV.
That's true. That's true. Let's meet little Precious, born with a congenital hand deformity. But that precious little child still has a lot of hope to join her friends in school one day.
Frame oba pani Mary Ofuriwa me nana ne akosia safoa emra ne maame nyim no e fine
me nyim ne 9 months me wo ne bae na ne nsane ne 9 yare aba ho
me wira ho papa
doctor na chuno date my say emfa kokofodua ne ewo no mu betimi aye
St Joseph o kofodua
na scan wenti ne esese ye na ye saba fi
nti ya ba fie nti akiri me hu sa kwara no onyin he say wanyin nti ese me yeden me ma aboafo bam no won be boa me se be akwara no betima ko school aboafo adawroma nti edi kan e de ne koye no ene won start year ne 9 no nti doctor afo no e hye ne POP wosome edu ansa ne 9 no etimi asisi fom ene won e ma me dabi ese me nsa amfa ne mra ne enye ne nsa no ni miniska ska na sa
sene ne nsa na ye no ontimi mfa de ontimi mfa nye hye
me de aduane hye ne nsa etimi free top nti na ai ehye ma werehwo ehye ma tetiye
nyama ko school
sanyi na bi jamu wa pati
senkwala ko school na se me ba ne nka ho eye hampa
to me bi ni hu me nana no a na me hu won ne ye pe ni woni ko school no a na me nana nso enyansa wo de be ko no me wira ho papa
Voda fofo ne ba ye no matese omo ba ye me ba ne nsa maninti mete sa ne sa ye me de pa
mete ye no madwendwen nyina magyae da wona se
da me wakache voda fofo ne se me do ma se pa
mpa ya me bo ne se na wona gina machi no ye kwaye akwala ne nsa no a ebe ye yi asidanka nyame
I think that the grandmother has to be commended for trying to save up. Actually, she did save up to get her feet done. That is good. But to bend the wapima I can't say no. But that girl smiled that she's sure she'll go to school one day. Aye, she's ready for school. She is ready for school. But what brings this on? Because the mother said, oh, no. Na ayesa. What brings it on? Is it age, nutrition, genetics?
So limb defects. There are a few things that can bring it. We really do not understand this is what brings it. Okay, a few maternal behaviors can predispose.
Okay.
Smoking while you're pregnant.
You
know, in a
smoking and define smoking.
Smoking.
I can hear somebody.
Hey.
So
smoking.
I can hear somebody.
Tobacco, cigarettes. I'm not too sure about weed and its effects, so I wouldn't want to talk. But I can speak strongly about tobacco.
Okay. What about? So be share day on the feature. Are you smoker?
And since I'm saying no, so we'll be a question. So why?
We need an orange dot.
Orange dot. You know,
basically. So
that one. Sometimes some medications, chemicals that you take in the formative stages. You know, in about the.
What do you mean by formative? Please break it down.
So the hand and the upper limb, lower limb, by about 26 days, they start to bud. Days.
And
after conception, 26 days they start to bud.
Indeed, 1 month.
They are budding. Yes. By about 2 weeks. Yes, it's not. It's by about 2 months, you have them sort of moving out. Now, so you can have an issue at this point. 26 days. Many women don't even know they're even pregnant.
Exactly.
You can have an issue there that may result in that. Secondly, you see, it's like we're packaging the thing in the uterus. So you can have packaging issues. You see, such that during pregnancy, there's oligohydramnios. Why is stiff? So that can also give some contractures in utero that can play. POP. That's a
Share
serial
10 months
casting.
answer.
It's a serial casting. Into Ochede, nine no pain, make sure that nine watch.
Yeah.
Good. So they'll do a serial casting to sort of straighten more and
Okay,
then
serial and just a continuous.
so what be your ABA se nine idea or start why they kaka for a while.
Kakra.
No, why they kaka
Almost
for a
no,
while.
okay.
Why they kaka. So that's what's probably happened. So, and given how she's now working well, you can say she's working well. So I think that this one may have been, I haven't seen her and assessed it, but I think maybe a packaging issue such that there were a few contractures in utero.
Hey, walk back to big words.
Contractures.
It's just on your space.
We're not getting space, so they have sort of farm, and they are not well aligned. The ligaments are not well in place, so the attitude of the limbs are not very. So it's possible there. That is what may have happened in this case. So that the POP has resolved this one, and then this one, if we had gotten early intervention, maybe it wouldn't have been this bad. And you know, it's said that with such things, if you don't correct them early, I will leave. I'll end it here.
If you don't correct them early, Abba.
Miss, I'll end it here.
What's the whole end, Miss Abba?
Now, why are you using my sentence to ask about
No, I want to know.
You want to know what? I say I'll end it here.
Na bones no. Already na joint, no, so already fixed.
Okay.
So contracture no is becoming permanent and very, very difficult, if not impossible, to reverse. Okay. So the earlier these things are done, when you can actually mold the structures in question, then the better it is. And I think we all know that it is your hands that really makes the human being superior.
Okay.
It puts us at a certain pedestal over all the other mammals, makes you skillful. And if you've got defects in your hands, then that becomes a bit of a problem. Sometimes, and I'd like to mention, I don't know whether Kay mentioned about alcohol, but
he didn't. He said
maternal
smoking.
alcohol abuse can cause some of these problems. Sometimes, to unbeknown to the mother, they can be exposed to certain infections. So
viral,
yes, rubella and other types of measles and all those CMV. A lot of viral illnesses can predispose to getting these. So you really don't have too much control. It's all that's how we find it back out. Na 10, it's a blessing, really. And when we realize these, we should do the best we can, because it puts you at a deficit. You don't have the function of your hands.
And so I'll just finish my statement since Fema wants to know. So it's like Abba said, the bones, these are visible ones that you can see. But even beyond that, there are motor end plates. Emma instruction, what makes it move? These are end plates, and if you don't correct it early, the neural connections don't form. So that's
brain to hand coordination.
That connections become difficult. So if you have any defects, if you notice the child has any defect, instead of going around prayer camps, passing here, asking grandmother, hiding from the parents, you bring the child to us in the hospital. We are very happy to look at this child. And I am certain that if there is help, when we start early, we are likely to get better results.
Yes, we are likely to always get better results when we seek the appropriate help at the appropriate time. We'll be right back.
So that mom can be able to open the door. This is it.
Here's my little brother doing something special. He's setting the camera up with another bright idea.
Let's just open the door.
Yay!
Mom, I got this.
Afei
die unso betumi nya kwanya sronko a ye nije ye power Vodafone so ye the data bundles a any seso Ghana ha bro ye ma oda ye so ne ni da so nyina bem enti beka ye ho nya data mo nije power bebre.
Vodafone, further together.
Into no, what's it romantica? Honestly, when I was in secondary school, I used to think that the word is romantic. Because for the first time, colleagues, or should I say students or friends, were complaining of joint pains and things like that. Yeah, because some are romantic, but apparently it was rheumatic. And it was strange to me. I grew up and I've seen it in older people as well. The question is, what really is it? And a command also to me a romantic and a rheumatic. To answer this, we have Dr. Ajamli. He's with us and he would explain everything to us as much as he can. Doc, welcome.
Yeah, thank you very much.
Have you heard that joke about romantic before?
Yeah.
Not being able to pronounce the rheumatic word.
Exactly. I remember when it was first introduced in medical school.
Yeah.
Yes, a lot of my colleagues started joking about it. Rheumatic heart disease,
romantic
heart disease.
Oh, heartbreak. Is that what it is? Like literally, is your heart broken? Or what is it?
Well, so rheumatic heart disease has nothing to do with love.
Okay.
Just to state it plainly like that. But it has to do with a problem or a damage to the heart as a result of some form of infection. So when we talk about rheumatic heart disease, basically we are looking at damage to the heart valves. That is, the heart has something within we call valves. So a damage to these structures as a result of this disease we call rheumatic fever is what is called rheumatic heart disease. So as been shown in the image as being seen, so on the right side you have something called valve, tricuspid valve. You don't worry so much about the name, the big name, but you can see something white, some 3, some 2 divided. So basically, these are like small doors within the heart that allows blood to move from one room of the heart to the other. Actually, in real life, the heart has 4 rooms. So you have the upper rooms, 2 of them, the lower rooms, 2 of them. So before blood moves from one room to the other, it has to pass through this valve. So as being shown by the 3D image, so the upper rooms are above there, and then the lower rooms down. So blood moves from the upper ones on the right to the lower one on the right, and then goes to the lungs and come back to the left side. And then the upper side comes down to the left lower side and eventually pumps blood to various parts of the body. So that is just to give you a teaser of what how the inner side of the heart looks like, and then the valves. So what happens is that when one gets a disease we call rheumatic fever, which is just similar to a common sore throat.
But so, it's not a common sore throat. It's similar.
It's similar.
So, but it's not the same.
Yes. So we have a germ. This germ we call streptococcus. Don't bother your name. You know, doctors, our names are so long.
Yes, and big.
Yes, and you need to go through medical school several years before you can mention them. But so this germ, so we take it in, and then it begins to multiply within the throat.
The germ, no, before they take in, is it from the air or from somebody or from
so
what?
It's passed from one person to the other. So just like common cold. So you cough or you sneeze, it's in the air, somebody also breathes it in, and then you get it. Then it gets into your throat, and then the germ begins to multiply there. So it is at that stage that you feel you have a sore throat. So usually you have pain, as usually the first sign. It may be followed by fever. So your body temperature is very high. And then these people who have this rheumatic fever, because the initial stage is called the fever, the rheumatic fever. So they begin to have some swellings on various parts of the body, especially the small joint. So you have some swelling. We call them nodules. So you may find them around the base of the thumb. You may find them on the fingers and so on, the toes and so on.
Like my friends I was talking about in school.
Exactly. So I think an image is being shown with the arrow. There is like some of those nodules. Or sometimes, in addition to these nodules, you may have like some kind of rash on the body. And this rash is like a patch on the body with the margins red. Again, has been shown. In the black skin, it doesn't show very well, but you can see on the right side of the screen, you have a patch there with a red margin. That is some of the skin patches you get. But on the white skin, it's quite very clear, as you can see on the skin. You have a patch and then you have the red thing around it. And so in addition to this, these people complain about joint pains. And these joint pains are typically on the large joints. So when you take the arms, you are looking at the wrists, and then the elbow, the shoulders, and then when you come to the lower limb, you are looking at the knees and then the ankles. And the funny nature of this joint pain is that we call it migratory, meaning that you feel it here today, tomorrow it comes there, tomorrow next it goes to maybe the toe, the ankle, then next it comes to the knee, then comes back. So we describe it as migratory joint pain. That is joint pain involving the large joint, and it moves from one joint to the other. So this stage of the disease, which is the initial stage, which is called the acute rheumatic fever. And it's, it is at this stage that it is important that the disease is diagnosed and treated. If it is not well diagnosed and well treated, that is when the complications of the effects of the rheumatic fever leading to rheumatic heart disease occurs. You got the link? So what happens is that now that you have got an infection, and then the infection is not properly treated, then the body has its own mechanism of fighting against diseases, as we know. Now, the chemical reaction that the body forms so that these germs, which I mentioned, the streptococcus, is supposed to go and attack it. The coating, the coating of this germ is similar to the coating of the heart valves. Yes. So this chemical reaction, in the one way or the other, hasn't got a brain. So what happens? As it's going to attack these germs that are causing the rheumatic fever, which is in the body, it goes also to attack the heart valves. So over a long time, usually between 2 to 10 years period, once this rheumatic fever occurs and it hasn't been treated, this chemical reaction continues to occur in the body in a very slow manner, and then continues to damage the heart valve. So as you can see on the screen, these heart valves, we have those on the left and then those on the right. The lot of the effect occurs mainly on the left side. So the heart valves that are on the left are usually affected more by this rheumatic heart disease.
Any reason why?
Well, the reason hadn't really been identified. The only thing we seem to know is that the pressure on the left side of the heart seems to be higher. So we don't know whether the reaction tends to occur on that side more than the other side where the pressure is low. So over a long time, 2 to 10 years, as I said, the heart valves gradually get damaged. Now, when it gets damaged, what happens is that they become so thickened, they become so hard, or sometimes they just become, they get eaten up. So when it's supposed to close, it doesn't close, or when it's supposed to open, it doesn't open. And if that occurs, it affects the function of the heart. So it is at this stage that the term, the rheumatic heart disease, comes in. So the fever is at the initial stage, rheumatic fever is at the initial stage, and then rheumatic heart disease is at the tail end.
All because your body is trying to fight some germs.
Exactly.
That is causing your sore throat.
Exactly.
But your sore throat is different from other sore throats because you get certain joint pains, swellings, and things you described. then your body will now think it's your valve and go attack it. Over a period of a decade or so, it can
start having problems.
Have heart problems. How would you know? Let's say someone didn't know all this and said, "Oh, I used to have this fever now." Yes, how would I know if my heart is getting towards the rheumatic heart disease? Is there symptoms of the disease itself?
Okay, so usually by the time they start showing signs of rheumatic heart disease, which is at the later stage, several years would have passed. So most of these people, when they come to you, they may not even remember the result that they had some fever some time ago with some patches, because it's over a decade or so. So at the time they come to you, most of them forgot about the initial sore throat. Some may remember that, in the past, I used to have a lot of sore throat. So they may not really link it to the rheumatic fever. But then when they come to you, symptoms of rheumatic heart disease, this time the symptoms show as symptoms of heart failure. Because at this stage, the heart is failing. So this stage, they only come and tell you, well, when I walk a short distance, I get tired, which I don't used to. Or they will tell you, I live on the first floor, but these days when I just take a step or two to the next floor, I become so tired. Or when I'm even at rest, I find it difficult to breathe. Or sometimes they may even tell you that, look, these days I have to use 2 pillows or 3 to be able to lie down and breathe well during the night. So when all this are happening, then what it means is that the heart is failing. So you only show the symptoms of the rheumatic heart disease at the later stage when the heart is failing. So the symptoms you show to the doctor is symptoms of heart failure.
Can it be cured?
So, well, then by the time you get to the level, let's look at the cure in 2 stages. At the initial stage where you have the rheumatic fever, yes, it can be cured because we have very good antibiotics available. So once you report to the appropriate place and that diagnosis is made, that antibiotics will be given to you, and then your sore throat will be well treated.
So what's the appropriate place before we move on?
So appropriate place, as you and I know, is that you need to go to the hospital. You
don't
go to the pharmacy shop.
Is there every doctor that knows this though?
Oh, but largely, most doctors are trained to pick up the basic or this initial stage of the disease. So most doctors will be able to tell you. So it is not good you only have a sore throat, you go to the pharmacy. As for the pharmacist, when you go, you say, I have a sore throat. They'll give you medications to take. But the best is rather to go to the hospital, let the proper diagnosis be made, and then the accurate antibiotics given to you to treat it. Now, once that stage is treated, then you don't have a problem later in life. But if later in life you now you started showing signs of heart failure, then we now have to treat you. So we'll make the diagnosis through various examination, investigations, and so on. But at that stage, the harm has already been caused within your heart. So like the image we saw, the heart valve is already damaged. You cannot do anything. So that stage, what you have to do is to give medication to treat the heart failure. Now, after treating the heart failure and the patient is better, then you go and do surgery. The surgery is in 2 forms. Either you can repair, as you can see on the image, the heart is so much damaged, but there are ways to repair it. So all those brown things that are on the heart valves, they can be scraped off so that the heart function can become normal. Now, when it's so severe that you cannot repair it, then you have to remove the damaged heart valves and put an artificial one there.
Oh, they have artificial ones?
Yes. So we have an artificial one that we can put to replace the heart valves. So in summary, the treatment is in 2 forms. At the initial stage is mainly antibiotics, but then when it comes to the latter stage where the damage is already caused, either you repair the valves or you replace the valve.
Sounds very costly.
Yes, it is very, very costly. So the initial one, maybe let me agree with you partly. The initial one, antibiotics, not too expensive. How much antibiotics will cost? Maybe not up to 200, 500 Ghana cedis. much less than that
Okay.
to treat the initial stage.
Okay.
But when you come to the latter stage, where you need heart surgery, then that is where the amount is very dire. Averagely, at the National Cardiothoracic Center where I work now, if your heart valve is damaged, you are coming for surgery, you are looking at between CD equivalents about $8,000 to $10,000. So
Times 7.
Is the dollar already 7? I see. That's interesting. So if the dollar is already 7, so you multiply your 8,000 by 7. So
Wow.
so you, and then when let's even take the upper end. So $10,000, 7. So almost 70,000 Ghana cedis for this latter stage of the disease.
Wow.
So compared to the smaller one, so the prevention
Yeah,
is
it's
better than cure.
Exactly.
Yes.
Exactly. Doc, we are so grateful. But one thing that I didn't ask is that can it occur at any parts in your any stage in your life, as in, is it children or adolescents or adults? Who is more at risk?
Okay. So I think that's a very important part you ask. Those at risk mainly are adolescents.
Oh, okay.
And the young people, usually in the low socioeconomic areas. So we are looking at the age of between 5 and 15.
Okay.
That is where the acute one, that is the initial one,
uh-huh.
happens. Then it means the rheumatic heart disease will show after a decade. So most of them,
young adults.
yes, are within young adults. So in our center, majority of the people who come with the rheumatic heart disease we see come within the age of about 40 to 50. So this 10-year group, 40 to 50 years, majority of our patients are within that group. So what it means is that a decade or more earlier, they had the initial infection. And pregnant people are also people who are at risk of this disease. And generally, people who live in a low socioeconomic income brackets, they are at risk of getting this disease because, of course, they are crowded. They can spread the infection from one person to the other. And they are the people who not even get money to go to the hospital.
Yes.
So they end up developing the complications of the condition.
It sounds like it cannot be prevented, though.
Oh, it could. If we are, well, as we are saying, if the initial stage, good diagnosis can be made early. So you have good health professionals. So patients go to them, the diagnosis is made early. The appropriate antibiotics is started. It is curable. It's just like malaria, similar. So it's curable. So it's treated. So it can be prevented. So as I would say, when you are sick, yes, don't go to the pharmacy shop. Go to the hospital. And maybe at least make the doctors make some little money.
Yeah. Doc, no. Let the doctors make a little money. Thank you so much for joining us. We are grateful and we've learned a lot. So it's not heartbreak. It's not about odwasem. And yen no umini mu ayokro akwala mni mu ayokro na so say na kakre wako drugstore wako toedru. Wako drugstore wako toedru. Adene nko nka onimni mu ayokro no ka say odene ko hospital. Osenya nkwala nketwa nkwa teenagers yi adolescents yi mu nyina internet mi sha akwala ne ho a sha wo ho a 10 years echi mfie du echi na adane akoma yare a sika na oboy no yes kaketwa etumi si dan depending on where you are mom but ne wedding intino ebe de oka ne say ho mfa ni mukra na ekura o se ma doctor nyes kakakra Pakoche doctor, non can choose say nya bia e so worry bebre, enye de be mo akoma yare no normal wadru na onye free. Why? Yeah, that's it. We'll be right back.
So that mom can be able to open the door.
This is it. Here's my little brother doing something special. He's setting
how you can be part of the extraordinary world of endless possibilities on Vodafone. With the best value and amazing data offers and services available in Ghana, your dreams are achievable. Get more for less with Vodafone data. Vodafone, further together.
Vodafone Healthline has assisted us in securing funding for Little Precious surgery. Let's go have a look.
This child has what we call constriction band syndrome. It has a nicer name, streeter dysplasia. And it's a problem that happens while the child is in the mother's womb. So it's also called amniotic band syndrome because it's the line of the amniotic cavity that comes off as strings and goes around the child. So it can tie a part of the child and cause deformities. At times, the deformities can be as bad as causing amputations. It's best in these conditions to wait till the child is about 2 years, 3 years. And that's when you can actually see the limbs well formed and you can do the separation. We are doing it under general anesthesia, and so the child has been anesthetized. We've done our markings to raise our, what we call our flaps, so that we can close. If we are not able to close fully, we'll use skin. We'll harvest a skin graft and then fill up the raw areas. So far, so very good. Anesthesia is comfortable. We think we can go on now. So interestingly, surgery took about an hour. It went a little faster than we expected. However, unfortunately, as would happen with these dysplasias, a lot of times just a tip or part of a finger or an entire finger may be lost. With this girl, just the tip of the index finger on the left side did not form. And so she will have a shortening of the index finger. Apart from that, all the other fingers were well formed and we've been able to separate them adequately. So able to get the some of the fingers were turned and twisted and so on. So because of that, we put in pins to straighten and to align them right. Usually we expect that within, children heal faster than adults actually. And so possibly by the next 2 weeks, maybe latest give it a month, she should be well enough to use her fingers for anything she needs. She can now write, she can now pinch, she can now hold, she can punch, and these are the things that are necessary. With the hand congenital abnormalities, it's important that hand surgeons, reconstructive surgeons do these cases. Because a lot of times those who are people or doctors or surgeons who are not hand surgeons may struggle and make things complicated before they are now referred to the reconstructive surgeons. So reconstructive surgeons at 37 at Rage, at Kolebu, at Confanoche, and there's one at Cape Coast. These are the people who should take care of these congenital hand anomalies. Otherwise, others handle it and make it more complicated. So we expect Precious to be able to fully use her fingers and her hands like everybody else should.
Afei die, usu betumi nya kwanya sronko a ye nije ye power Vodafone so. Ye di data bundles a eni seso Ghana ha bro. Ye ma da ye so, ni eni da so nyina bem. Enti beka ye ho, nya data mo eni je power bebre.
Vodafone, further together.
Today, in This Week in Medicine, we talk about a rare occurrence. You wanna guess? Fetus in fetu. This is a rare congenital anomaly with an incidence of 1 in 500,000 births. In simple terms, it means a baby within a baby. It is characterized by the incorporation of one or more partially developed fetus into the body of an otherwise normally developed fetus. It was first described in 1800. Now, I'm going to go into some details for the young ones that want to be doctors or scientists. The rest can go on a commercial break. Here we go. Genetic studies suggest that this phenomenon occurs in monozygotic monochorionic diamniotic twin gestations when one twin is absorbed during the ventral folding of the trilaminar embryonic sac. A lot of things to go, right? Well, this is not a cancer. The main adverse effect of this is from the pressure effect of the twin growing within the twin. Also, the twin within the other one feeds off the normal twin. And that's the problem. We turn our attention to India, where a farmer, Sanju Bhagat, lived his whole life with a bulging abdomen, as though he was pregnant. Indeed, people in his community referred to him as the pregnant man. In 1999, he was rushed to the Tata Memorial Hospital in Mumbai because he had respiratory embarrassment. He just could not breathe from the distended abdomen. To the surprise of the surgeons, there was an unusual creature within the abdomen with formed limbs, fingernails, hair. Yes, indeed, Sanju was pregnant with his twin brother for 36 years. That's all we have for This Week in Medicine. Fetus in fetu. In that same year can we hungaka, but we see ye patch there and tafon a kutun keshe kunum. Usually ni ye fun. Until chere and tan a kuba keshe kun ni fun say abofaban or form ye funuma. Ebu wa or done no obu keshim obu akeshim oma ninuan obehyenum na no honam na ninyimpeduan wa form around ninuan wa behyenum. Na ABC wo India 1999 wo ye no operation with the ninuan wa hyenum for 36 years. This is all we have for This Week in Medicine.
Welcome to Jewels in the Kitchen with me, Fermat. Today we are talking about moko shraka. Pepe. I'm moving, but moko ankasa. Ebi say, you be anim, nutrition be anim. Baba shock or vitamin B6 or vitamin A. At what was so, but when him say, mabat na hide. Word ben abeti, anti-inflammatory, of course. Into moko, yes, moko ya anti-inflammatory. What does it mean? As usual, se krobi omua ebwa ma umia krono. Mokona, I didn't ama mokano ye yano. You know, the heat of pepper is what people have been promoting for weight loss, and it's true. It's very true. The hotter the pepper, the more effective it is in helping you lose weight because it boosts your metabolism that way. Sa I didn't ama mokoswano ye yano. A doctor for ne pharmacist no ne sankofo no etumi I extract e dey share creams mu for topical pain relief. Yes. Men can say, "Come moko shakasra, ujonkuzu, utumi ya dia, ene boa oswa yo." But men can share no one say moko wa hono, a powerful one kasa. Moko so ebe shock moko boa kuma. Ai, minim say udi moko bro so ma kuma hwehwe. One her crowd when you diarrhea, no be have coke ni salt na can one seven. But enya na make kan wasem ene. But see ati say moko ho anu ya. But dia ema anu ya no so eboa pomodin. Into the up to your limit. They want to build up their ability to withstand the heat, no. Because after all, it's an acquired taste, isn't it? Do you think? It's an acquired taste.
Meko.
Yeah, it is.
Meko dear.
Maybe you don't need to boost your metabolism. I know somebody.
Hey, Meko, it's not the problem. The problem is not the D of the Meko, but the Meko. When the Meko is Mekoing,
and you get diarrhea,
and if you get diarrhea down, there's something happen to you. But when it's getting to the back, my brothers and sisters, because of that, I assume when it's too Meko shots, I will let it go because
it just means you went beyond your limit. That's why I say stay within your limit.
I keep my limit very, very not Mekoi. Because when it Mekos,
it's like drinking alcohol. You know you have to stay within limits. The same with pepper. Come on.
That's a Meko. If I can feel the Meko, then it means that there's Meko. Of course. Meko should be inside, but if I can feel it, if it's I should put on my jonku one day, maybe I'll try that one. But inside,
but the cream exists.
To pass
and the patches exist.
Yes, no, I mean it makes sense. It's we call it the
capsaicin, exactly.
Yes, capsaicin, but we call it the gator theory.
Yes.
So it actually has a way of helping with pain.
Yes.
I mean, that one is there. But to eat the Meko.
But what was your highlight for today?
I think it's been an all-round good program. I think that nutrition, I mean, I'm taking it today that we've talked about inflammation, and we take it for granted.
Yes.
All these vegetables and fruits that you've been talking about.
Even our local spices.
They do play an important role
in
our lives, and we should not take it for granted. Ghanaians don't like fruit. They don't like veggies. They don't know the importance of what we are eating. And I think it's a good thing that we're talking about it this season.
But before we all sat here and I was joking about romantic heart disease, you actually said you picked up a few in your personal practice. It's nice to know it's not just Dr. Ajamli who has been seeing this, but you also come across it.
Oh yes.
And what was interesting was you said it's a doctor.
Yes,
You think they would know more than me?
Well, that does not exclude us from getting diseases.
But that
come on, be fair. No. It can easily, slide through and then
it's one of those things,
anybody else.
And you can't control it.
Yes.
See, it's an immune response to an infection that we all get. So it's the way you respond to it. But what is worrying is the long-term sequelae on the heart that worries.
Yeah.
And it's still with us.
It is.
See, in other countries, it's been eradicated more or less because of a change in the environment and the sanitation and all of that.
Yeah.
But in our part of the world, it still pops up.
It's true.
Intermittently.
It's true. It's like saying that a nutritionist or a doctor can never have a headache.
Have you not seen an obese nutritionist before?
We have. It's okay. I knew where you were going with it. If you're not sure what to do, don't forget to call 255 because there are qualified doctors waiting to help you. And you don't have to mention your name. It can be anonymous. And when you ask about just dial 255. But 255 can ask them or bet sure the other. Even if it includes penile transplant. They'll tell you. I'm sure of it. All right. It's been lovely. I've enjoyed myself. I've learned a lot. And it's not, once again, romantic heart disease. It's rheumatic. Anti-inflammatory. See you next week. It's bye for now. Bye.
Vodafone, further together.